on Healthy Living. Once again, we're with Jeremy Clark, and we're talking about really some positive things to come out of this time of newness, if we will. And I always laugh, we talk about a new normal. My saying is this: normal is a dryer setting. Permanent press,
well
delicate,
said.
and normal. So we
well
don't really,
said.
there is no normal.
Right.
This is just the way it is.
Right.
So talk to us a little bit. You said you had 4 guiding principles that your staff and patients are living by now. Let's talk a little bit more in depth about those.
Right, so we're really trying to lead the creation of a safer standard of care. A safer standard really built around testing, screening, spacing, and cleaning.
Okay.
And so as we go through each one of those, on the testing front, we've had some great developments just in the past week. You know, first of all, we were very honored that Coastal Carolina Hospital was selected by DHEC to receive the new Abbott ID Now Rapid Coronavirus Testing Platform. So what that means is that we've had a great working relationship with DHEC and some other private labs, getting results back when we test a patient for the coronavirus. They're getting those results back in anywhere from 18 to 24 hours, which is great.
Yeah.
But this new platform allows us to get results back in less than an hour. And so what it allows us to do is for a patient who's really critical and whose treatment may really change based on that diagnosis, allows us to get that rapid diagnosis of either positive or negative for coronavirus. So that's a great asset for our entire health system. It's located at Coastal Carolina Hospital, but it's accessible to patients who are at the hospital, at Coastal Carolina Hospital, or at Hilton Head Hospital, or at the Tidewatch Emergency Department. So really across the market.
So if someone wants that test or feels like they're symptomatic and really is just not sure, what's the procedure for that testing?
So that testing, we are really prioritizing that because the resources are so limited statewide. We're really prioritizing that on inpatients who are really at a critical point in their treatment protocol.
Yes.
And so working with the physicians involved to really make sure that those patients receive the appropriate test. Now that said, we also just started doing outpatient coronavirus testing for anyone who is symptomatic and has a physician order.
Okay.
So at both hospitals, at both Hilton Head Hospital and at Coastal Carolina Hospital, patients can show up with a physician order. Their physician can fax an order over to us, and they can be tested for the coronavirus. Those results are coming back in less than 24 hours.
So what I hear you say on the second piece of that testing is, if you are symptomatic, don't feel good, call your physician.
Correct.
It's kind of an initial screening, if you will.
It is.
And then get an order, and then you can come. That's really, we're lucky for that. That's wonderful.
Well, it's a great way to look at it that way. It's not everyone needs to be tested.
Right.
You know, if you are asymptomatic and just concerned, that's probably not the best use of the resources that we have in our community or nationwide to be done. But if you and your physician jointly agree that you need to be tested, you may be positive for this, we want you to have access to it at multiple locations in our community.
Okay, so that's testing. Next.
So screening. So, you know, we made a lot of changes as we went through this situation on who we allowed into the hospital. And as a result of that, we created a very safe environment inside the walls of our hospitals. We've done that by limiting access to visitors, really restricting our visitor policy, except with a few limited exceptions, but really limiting how people access the hospital. And so now everyone who enters our hospitals every single day is screened for respiratory issues, any other health issues, ask about their travel history, their temperature is taken, and they're given a mask. And so again, we've created a very safe environment inside the walls. We want to make sure that everyone coming in helps maintain that safe environment. So we're going to continue to do a lot of screening, even as we open up, and we're adding, we're starting to do elective surgeries now. We're doing elective imaging procedures and lab work. So we're starting those to ramp back up, but we are maintaining that strict screening criteria so that we can keep everyone inside the hospital safe. That's our staff, that's our physicians, and our patients as well.
And again, this is Nurses Week, National Nurses Week, and it's interesting to talk to a lot of the nurses because they're incredible, and they remind us daily that we're wearing masks to protect each other.
That's right.
Not necessarily ourselves.
That's right.
So it's really a gift.
It is, and it really takes everyone working together to maintain that safe environment that we've created.
I swear it's just not that hard if we do that.
Yeah.
If we do our part. Standing 6 feet apart is not that difficult. Although I really like my kind of space, I will say that. All right. Testing and screening next.
Spacing. So it's something that we hadn't thought a lot about prior to this situation. It's been a real learning for us, but really what you'll see in our hospitals is in the waiting areas, the chairs have been removed so that their patients patients are waiting 6 feet apart from each other. There are floor clings on the ground with footprints to show people where they should stand 6 feet apart. So really just little things like that to help people remember to keep their distance from other patients that are there. You know, our staff are fully masked up and have enough personal protective equipment because in order to provide care, they're going to need to be in an approximate location to you. But for different patients interacting with other patients, we want to keep them as separate as possible. And speaking of separate, in both of our hospitals, every potential coronavirus patient is kept in a private room in an area away from other patients. And we do that just to maintain that safe environment. So we know that most patients who are going to present to our hospitals are not here for the coronavirus. Many are here for elective surgeries, and we want them to know that they're safe. And so we're able to put them in designated rooms, designated areas that are away from the coronavirus patient.
Which makes so much sense. And last but not least.
Last but not least is cleaning. You know, we are fortunate to have outstanding environmental services colleagues who do a great job throughout the year. We've taken this as an opportunity to really allow them to redeploy to those really high impact patient areas where patients are going to be, cleaning those areas more and more regularly, just constantly cleaning those, and asking our staff to take on additional responsibilities for cleaning their own departments. And so we've made some changes, you know, most notably our registration staff. These are the people, sometimes the first people you see when they come in.
That's right.
So what they've done is now in between every single patient, they're wiping down the desk in front of them. They are, you know, giving the patient the pen. The patient fills out the paperwork with the pen. They take the pen with them.
I never thought about that.
Then on an hourly basis, they're going around and wiping down the furniture in their waiting room. So by us all doing a little bit more, it allows us to create an even cleaner environment than we ever had before, which is really exciting. You've got hand sanitizer there. We've been very fortunate that we've been able to continue to secure ample amounts of hand sanitizer and really posting it throughout our hospitals so that patients and staff and physicians know that it's always there if they need it. So little things like this are, I believe, truly going to make us a safer environment than we were before.
Well, it's really impressive to talk with you. In our last few minutes, one of my questions is we've got a lot of, we survive on our visitors, and we are excited about having visitors. I think a question for all of us as good stewards of our community, I think one of the reasons we've been so fortunate is we've all worked really hard to do exactly what you're saying and work together. How do you share with the visitors? What do you recommend, again, that they do here? Because it may be different than where they were before.
You know, we ask for everyone to continue to listen to the CDC, continue to listen to local leaders. You know, we're still trying to maintain social distances, still wearing a face mask when you go out on a regular basis, still washing your hands. I mean, all these things that should be being done all the time, whether you're in another part of the country or you're here. We ask that you please maintain that. We have a wonderful community here. It is a great place to visit. It's an even better place to live.
Yes.
And we want to keep it that way. We want to keep it safe. We want to keep it safe for everyone around here.
Well, before we go, I would love to talk about, it's Nurses Week this week.
That's right.
And next week is another special week.
That's right. So we've got Nurses Week and then followed up by Hospital Week. And, you know,
couldn't be more perfect timing.
It is absolutely perfect timing. To see everything that's gone on over the past couple of months, to know the people inside these buildings, inside our system, and how incredible they are during normal times.
Yes.
To see them really step up, and whether it be cross training or, you know, providing really compassionate, high quality care during a very scary time.
Exactly.
You know, with the disease, with the virus that we didn't really know a lot about, is just really incredible. And so for all of our nurses, for all of our hospital colleagues, the way that you guys have stepped up over the past couple of months has just been awesome. And I'm very appreciative of it, but more importantly, our patients are very appreciative of it.
Are you doing anything special?
So lots of food. Food always goes well in a hospital. So we've had lots of snacks and food for Nurses Week. We've got even more coming next week for Hospital Week. So a lot of food and just general recognition. And you know, we have an awesome team in our health system, and they do wonderful work.
Well, we're going to look forward to talking with you again shortly, and hopefully each time we talk, we can talk more and more positive things. I think being real and being transparent and being authentic has been very helpful in getting the message across and being consistent, and I'm really grateful, and I know all of our viewers are too. So Jeremy, as always, thank you for joining us.
Thank you.
Thank you all for joining us here on Healthy Living. Please have a wonderful week.